Hi, my name is Melissa and I'm a student at the University of Charleston. Today I want to talk about cerebrovascular accidents, otherwise known as strokes. Strokes can occur in two different types, hemorrhagic strokes and ischemic strokes. First, I'm going to talk about hemorrhagic strokes. Hemorrhagic strokes are strokes that are caused by the rupture of a blood vessel in or on the surface of the brain with bleeding into the surrounding tissue. This type of stroke accounts for about 13% of strokes. They are classified into subcategories such as intracranial strokes, which account for 7%, subarachnoid, which accounts for 8%, and other causes, which account for 1%. They occur with bleeding into the brain tissue, the ventricles, or the subarachnoid space. Uncontrolled hypertension accounts for 80% of hemorrhagic strokes as a result of primary intracerebral hemorrhage from a spontaneous rupture of the small vessels. Symptoms are produced when a primary hemorrhage, aneurysm, or AVM presses on the nearby cranial nerves or brain tissue, or when an aneurysm or AVM ruptures, causing a subarachnoid hemorrhage. Manifestations occur based on the hemisphere of the brain that the stroke occurs in. Right-sided hemispheric strokes produce the following symptoms: left-sided paralysis or weakness, left visual field deficit, spatial perceptual deficits, increased distractibility, impulsive behavior and poor judgment, and a lack of awareness of deficits. Left hemispheric strokes cause the following symptoms: right-sided paralysis or weakness, right visual field deficit, aphasia, which is problems speaking and understanding language, whether it's global, expressive, or receptive, an altered intellectual ability, slow, cautious behavior. The prognosis after a hemorrhagic stroke is poor due to the amount of ischemia and increased intracranial pressure caused by the expanding collection of blood. Prognosis improves significantly if it's caught early and the clot can be removed with a cessation of the active bleeding. Ischemic strokes are a sudden loss of function resulting from the disruption of the blood supply to a part of the brain. They are divided into 5 types based on cause. Large artery thrombotic strokes, which account for 20%, are caused by atherosclerotic plaques in the large blood vessels of the brain. Thrombus formation and occlusion at the site result in ischemia and infarction. Small penetrating artery thrombotic strokes account for 25% and affect one or more vessels. Cardiogenic embolic strokes account for 20% and are associated with cardiac dysrhythmias, usually afibrillation or valvular heart disease. Cryptogenic strokes account for 30% and have no known cause. Other types account for 5% and are caused by illicit drug use, such as cocaine, coagulopathies, migraine, vasospasm, and spontaneous dissection of the carotid or vertebral arteries. Ischemic strokes are caused by an obstruction of the blood vessels, which causes the disruption of the cerebral blood flow, causing a series of cellular metabolic events called ischemic cascade. This process leads to electrolyte imbalances and cell necrosis. Manifestations of an ischemic stroke are as followed: numbness or weakness on the face, arm, leg, especially on one side of the body only, confusion or change in mental status, trouble speaking or understanding speech, visual disturbances, difficulty walking, dizziness or loss of balance or coordination, and a sudden severe headache. The prognosis is usually good, as symptoms may reverse with fibrinolytic therapy using tissue plasminogen activator or TPA within 3 to 4.5 hours of the initial symptoms, unless it's contraindicated by active bleeding. The diagnostics, complications, and nursing actions for both types of strokes are similar and as followed. Diagnostic procedures include an MRI or magnetic resonance imaging, computed tomography or CT imaging, and or a computed axial tomography or CAT scan can be used to identify edema, ischemia, and necrosis. A magnetic resonance angiography or cerebral angiography are used to identify the presence of a cerebral hemorrhage, abnormal vessel structures such as AV malformation aneurysms, vessel ruptures, and regional perfusion of blood flow in the carotid arteries and brain. A lumbar puncture is used to assess for the presence of blood in the cerebrospinal fluid. A positive finding is consistent with cerebral hemorrhage or ruptured aneurysm. The Glasgow Coma Scale is used when the client has a decreased level of consciousness or orientation. The risk for increased intracranial pressure exists related to the swelling of the brain that can occur secondary to ischemic result. An insult. Therapeutic procedures include systemic or catheter-directed thrombolytic therapy, which restores cerebral blood flow if given within 6 hours of the onset of symptoms after hemorrhagic stroke is ruled out as the cause. Carotid artery angioplasty with stenting, or CAS, involves using a catheter inserted into the femoral artery to catch clots debris while a stent is placed in the carotid artery to open a blockage. Carotid endarterectomy opens the artery by removing atherosclerotic plaque. Extracranial intracranial bypass is a craniotomy performed to improve cerebral perfusion. It increases blood flow around the blocked artery and helps to restore blood flow to the affected areas of the brain. Complications of strokes include dysphagia, or a difficulty swallowing, which can result from neurologic involvement of the cranial nerves that innervate the face, tongue, soft palate, and throat. As a result, the client's risk of aspiration is great. Not all clients who have experienced a stroke have dysphagia, but all should be evaluated prior to reestablishing oral nutrition and hydration. Unilateral neglect causes a loss of awareness of the side of the body that's affected by the stroke. The client cannot see, feel, or move the affected side of the body, therefore he forgets that it exists. This lack of awareness poses a great risk for injury to the neglected extremities and creates a self-care deficit. Nursing actions after a stroke would include monitoring vital signs every 1 to 2 hours and notifying the provider immediately if a blood pressure exceeds a systolic of greater than 180 or a diastolic of greater than 110, as this can indicate an ischemic stroke. A fever can cause an increase in intracranial pressure, and temperature should be monitored to avoid this increase. Provide oxygen therapy to maintain levels above 92%, or if the client's level of consciousness is decreased. Conduct cardiac assessments and place on a monitor to detect arrhythmias or regularities. Monitor for changes in level of consciousness, which is a sign of increased intracranial pressure. Elevate the head of the bed approximately 30 degrees to reduce increased intracranial pressure and to promote venous drainage. Maintain the head in the midline neutral position. Institute seizure precautions. Assist with the client's communication skills if speech is impaired. Assess the ability to produce and understand speech, speak slowly, and provide picture boards or other assistive devices as needed. Assess swallowing and gag reflexes before feeding and assist with safe feeding as needed. Prevent complications of immobility such as atelectasis, pneumonia, pressure sores, and deep vein thrombosis. Maintain skin integrity by repositioning frequently and using padding. Encourage passive range of motion every 2 hours to the affected extremities and active range of motion every 2 hours to the unaffected extremities. Elevate affected extremities to promote venous return and reduce swelling. Maintain a safe environment to reduce the risk of falls. Provide assistance with activities of daily living as needed. And instruct the client to dress the affected side first and to sit in a supportive chair that aids in balance. NLN competencies include human flourishing, which is accomplished by ensuring that the client is treated with dignity and respect at all times. Providing communication devices as needed helps to demonstrate this competency. Professional identity is providing the best possible care to the client while assessing the client and when assisting with activities of daily living. The spirit of inquiry is accomplished by assessing the client for potential causes of the stroke, signs of dysphagia and aphasia, and inquiring about assistance for these conditions from other interdisciplinary sources such as speech therapy, occupational therapy, and physical therapy as needed. Nursing judgment. Use nursing judgment to promote opportunities for the improvement of the client's condition. Recommend treatment modalities, medications, or assistive devices that might improve the client's quality of life. The resources that I used for this were the CDC's Know the Facts About Stroke and Understanding Stroke Risk, ATI RN Adult Medical Surgical Nursing Edition 10, and Hinkle and Cheever, Bruner and Sidarth's Textbook of Medical Surgical Nursing, 14th edition. Some flyers that are useful for quick reference guides are Understanding the Stroke Risk in Women, which can be downloaded from the CDC's website, and Know the Facts About Stroke, which also was downloaded from the CDC's website. This flyer has quick acting advice. If a stroke happens, it says to act fast, the acronym FAST. F standing for face drooping. Ask the person to smile. Does one side droop? A for arm weakness. Ask the person to raise both arms. Does one arm drift downward? S, speech difficulty. Ask the person to repeat a simple sentence. Are the words slurred? T, time to call 911. If the person shows any of these signs, call 911 immediately.